Welcome to Luck Scout Psychology. Mental health is essential for overall well-being. It affects how we think, feel, and interact with the world. Unfortunately, millions of people struggle with mental health conditions. These conditions can range from anxiety and depression to personality disorders. Understanding these disorders is crucial for promoting awareness, reducing stigma, and seeking appropriate treatment. In today's video, we'll delve into a specific personality disorder, dependent personality disorder, often called DPD. Dependent personality disorder is characterized by an excessive need to be taken care of. People with DPD often have difficulty making independent decisions. They rely heavily on others for reassurance and guidance. This reliance can affect many areas of their lives, including relationships, work, and daily activities. Throughout this video, we'll use relatable examples to illustrate the challenges faced by individuals with DPD. Our goal is to provide a clear understanding of this complex disorder. DPD can significantly impact a person's relationships. The need for constant reassurance and fear of separation can lead to clingy behaviors. This can put a strain on even the strongest bonds. Additionally, DPD can affect work life. Individuals with this disorder may struggle with taking initiative or handling criticism. This can hinder their career progression and job satisfaction. It's important to remember that DPD is a serious mental health condition, but with proper treatment and support, individuals can learn to manage their symptoms and live fulfilling lives. Dependent personality disorder (DPD) is characterized by a pervasive and excessive need to be taken care of. This need manifests in a pattern of submissive and clinging behaviors. It also involves a fear of separation from those they depend on. To fully understand DPD, we need to examine its key features in more detail. Individuals with DPD often struggle with a deep sense of insecurity and inadequacy. They may doubt their own judgment and abilities. This lack of self-confidence fuels their dependence on others for reassurance and direction. One of the most prominent symptoms of DPD is difficulty making decisions. This difficulty can range from minor, everyday choices to major life decisions. People with DPD often feel overwhelmed by the responsibility of making choices. Imagine someone with DPD trying to decide what to eat for dinner. They might consult multiple people, second-guess their own preferences, and worry excessively about making the wrong choice. This indecisiveness stems from their fear of disapproval and their need for constant reassurance. Another hallmark of DPD is the fear of disagreeing with others. Individuals with this disorder often go to great lengths to avoid conflict or disapproval. They may agree with opinions they don't share or suppress their own needs to please others. This fear of disagreement can lead to unhealthy relationship dynamics. People with DPD may find themselves in one-sided relationships where their own needs are consistently overlooked. They may stay in unsatisfying or even abusive situations out of fear of being alone. While the exact causes of dependent personality disorder are complex and not fully understood, research suggests that a combination of factors contributes to its development. These factors can be broadly categorized into genetic predispositions, environmental influences, and early childhood experiences. It's important to note that having one or more of these risk factors doesn't guarantee the development of DPD. Rather, these factors interact in complex ways, and their influence can vary from person to person. Understanding these potential causes can help us identify individuals who might be at risk and provide early intervention when needed. Genetics can play a role in an individual's susceptibility to developing DPD. Studies have shown that DPD tends to run in families, suggesting a genetic component. If a close relative, such as a parent or sibling, has DPD, the likelihood of developing the disorder increases. However, it's crucial to remember that genes are not destiny. While a genetic predisposition might increase vulnerability, it doesn't automatically mean someone will develop DPD. Environmental factors and life experiences also play a significant role in shaping personality and determining whether a genetic predisposition translates into a full-blown disorder. Early childhood experiences, particularly those related to attachment and parental caregiving, can have a profound impact on personality development. Children need a secure and nurturing environment to develop a healthy sense of self and independence. When these needs aren't met consistently, it can increase the risk of developing DPD. For instance, overprotective or authoritarian parenting styles can hinder a child's ability to develop self-reliance and autonomy. If parents are overly controlling or discourage independence, children may learn to rely excessively on others for decision-making and reassurance. This can set the stage for dependent personality traits to emerge later in life. Diagnosis of dependent personality disorder, DPD, is a nuanced process that begins with a comprehensive clinical interview by a mental health professional. During this interview, the clinician explores the patient's entire history, including their emotional, social, and mental health backgrounds. This thorough understanding is crucial because DPD symptoms often overlap with those of other anxiety or mood disorders, which can complicate the diagnosis. In addition to the interview, the clinician observes the patient's behavior and emotional state. Attention is given to how they articulate their need for support, their reactions to hypothetical scenarios of separation or independence, and their overall demeanor. These observations are essential for assessing the severity and persistence of dependent behaviors, which are central to confirming a DPD diagnosis. The process also involves gathering information from close contacts such as family members or partners. Their insights can provide a clearer picture of the individual's interpersonal relationships and dependency traits. This multi-source feedback helps to avoid misdiagnosis and ensures a more accurate understanding of the individual's condition. For a more structured assessment, mental health professionals often utilize specific diagnostic tools and questionnaires. One common instrument is the Structured Clinical Interview for DSM-5, or SCID-5, which is designed to make reliable, standardized assessments of mental disorders, including personality disorders like DPD. Another tool frequently used is the Millen Clinical Multi-Axial Inventory 3, or MCMI-3, which assesses a wide range of personality disorders and clinical syndromes. It provides scores that indicate the presence of disorders, and its results are useful for both diagnosis and treatment planning. These tools are supplemented by self-report questionnaires that ask the patient to describe their feelings, behaviors, and attitudes. These diagnostic instruments are crucial because they provide objective metrics that help to quantify the patient's symptoms and compare them with established diagnostic criteria. This methodical approach reduces the subjectivity inherent in diagnosing personality disorders and ensures that the diagnosis is grounded in empirically validated standards. Diagnosing dependent personality disorder presents several challenges. The subjective nature of the disorder's symptoms, such as fear of abandonment and difficulty making decisions, makes it particularly challenging to distinguish from normal dependency behaviors seen in various cultural or familial contexts. Moreover, patients with DPD often seek treatment for symptoms of anxiety or depression rather than for dependency issues, which they might not recognize as problematic. This can divert focus from the underlying personality disorder, complicating the diagnostic process. It requires clinicians to be particularly vigilant and sensitive to the subtleties of the patient's interpersonal dynamics and self-perception. Another significant challenge is the potential for co-occurring disorders. Individuals with DPD frequently exhibit symptoms of other mental health conditions, which can obscure the diagnosis. Careful differential diagnosis is necessary to ensure that treatment addresses all pertinent aspects of the individual's mental health. This thorough and cautious approach helps to tailor interventions that can effectively manage DPD and improve overall functioning. With these challenges in mind, the accuracy of diagnosing DPD hinges on the expertise and perceptiveness of the clinician, highlighting the importance of specialized training and experience in the field of personality disorders. Treating dependent personality disorder, or DPD, is a journey that requires a multifaceted approach tailored to the individual's specific needs and challenges. It's not about curing the disorder, but rather equipping individuals with the tools and strategies to manage their dependency, build self-reliance, and lead fulfilling lives. This journey often involves a combination of psychotherapy, and in some cases, medication, along with social support and lifestyle adjustments. Psychotherapy, particularly cognitive behavioral therapy, or CBT, is considered the cornerstone of DPD treatment. CBT helps individuals identify and modify negative thought patterns and behaviors that contribute to their dependency. It empowers them to challenge their fears of independence, develop problem-solving skills, and build healthier relationship patterns. The therapeutic process focuses on gradual and sustainable change, recognizing that overcoming deeply ingrained dependency takes time and effort. It's about empowering individuals to become active participants in their recovery and develop the confidence to navigate life's challenges with greater autonomy. Psychotherapy for DPD often involves a combination of individual and group therapy sessions. Individual therapy provides a safe and supportive space for individuals to explore their dependency, understand its roots, and develop personalized coping mechanisms. It allows for a deep dive into their unique experiences and challenges, fostering a strong therapeutic alliance that's essential for progress. Group therapy, on the other hand, provides a platform for individuals with DPD to connect, share experiences, and learn from one another. It helps reduce feelings of isolation and shame, often associated with DPD, and provides opportunities to practice assertiveness and independence in a supportive environment. In group settings, individuals can witness the successes and challenges of others, gaining valuable insights and motivation to persevere in their journey towards greater autonomy. The shared experience fosters a sense of community and belonging, crucial for individuals who may have struggled with forming healthy relationships. While psychotherapy forms the foundation of DPD treatment, medications may be prescribed to address co-occurring mental health conditions such as anxiety or depression, which are common in individuals with DPD. Antidepressants or anti-anxiety medications can help alleviate these symptoms, making it easier to engage in therapy and manage daily life. It's important to note that medication alone cannot cure DPD. Medications primarily address the symptoms of co-occurring disorders, creating a more conducive environment for psychotherapy to be effective. In addition to therapy and medication, social support plays a vital role in DPD recovery. Encouraging individuals to build healthy relationships with family and friends, participate in support groups, and engage in activities that foster independence can significantly impact their well-being. Understanding dependent personality disorder is crucial not only for those who live with it, but also for their loved ones and society as a whole. Increased awareness helps dispel the stigma surrounding mental health conditions, encouraging individuals to seek help without shame or hesitation. When we understand DPD, we can approach it with empathy and compassion, fostering a supportive environment for those affected. Remember, individuals with DPD are not choosing to be dependent. Their behaviors stem from deep-seated fears and insecurities that often originate in early childhood experiences. Judging or criticizing them only exacerbates their feelings of inadequacy and hinders their progress. Instead, we need to create a culture of understanding and acceptance, encouraging open conversations about mental health. Education and awareness campaigns are vital in challenging misconceptions and fostering empathy. By sharing accurate information about DPD, we can help others recognize the signs and symptoms, encouraging early intervention and access to appropriate treatment. This collective effort can make a significant difference in the lives of individuals with DPD, empowering them to seek help and embark on their journey of recovery. While dependent personality disorder presents real challenges, it's essential to remember that recovery is possible. With appropriate treatment, individuals with DPD can learn to manage their dependency, build self-reliance, and lead fulfilling lives. Therapy empowers them to challenge negative thought patterns, develop healthy coping mechanisms, and cultivate healthier relationships. The journey of recovery is unique for each individual. It requires patience, perseverance, and a strong support system. Loved ones play a vital role in providing encouragement, understanding, and a listening ear. By fostering an environment of trust and acceptance, they can empower individuals with DPD to embrace their journey toward greater independence and well-being. Living with DPD doesn't have to mean living a life of limitations. With increased awareness, access to quality mental health care, and unwavering support, Individuals with DPD can break free from the constraints of dependency and create a future filled with hope, meaningful connections, and the freedom to live life on their terms. Please like the video and share it with others. It helps those who are suffering. Thank you for watching.